Good evening. My name is Eric Nelson. I'm with AARP South Dakota, and welcome to the AARP South Dakota 2021 AARP On Tap event. For those that you don't know, my job responsibility for the AARP South Dakota office is the Director of Advocacy, and we are happy to have you with us this evening. We've got an important topic to discuss here for our 2021 virtual On Tap event. You may recall we did our On Tap events virtual last year as well, as we continue to navigate our way through the COVID pandemic. We wanted to have an opportunity to connect with you and talk about some important issues facing our state. And our On Tap event is a great way to do it. This evening, we will be talking about Medicaid expansion. I'm sure a lot of you have heard about Medicaid expansion in the news recently. And it's an important issue that has an impact on South Dakotans that we are working to get certified to vote on in the November 2022 election. So I'm happy to tell you that we have a number of panelists of some of my colleagues from across the state, and we'll get to them very soon and do introductions. But first, a couple of housekeeping items that I'd like to go over. First of all, thank you again to our AARP members that are with us this evening. I also know that we have a number of partners with the AARP that are tuned in to hear our important discussion on Medicaid expansion. And then finally, to our AARP members, I'd just like to point out this is our On Tap event. Ideally, we'd be doing this at a local restaurant in your community and having a drink and some appetizers to talk about these important issues. But if you did register, you will have received this cocktail kit in the mail. And I hope you've taken an opportunity to mix yourself a cocktail this evening. And as we talk about Medicaid expansion, sometimes you have to drink to get through a Medicaid expansion conversation, especially with how it's been going in South Dakota in the past. But moving forward, we're very excited about where we're at. And I will remind AARP members that if you haven't registered yet, you can still register up until 8 o'clock this evening to receive this cocktail kit. And you'll also be entered into our grand prize drawing. And this year, our grand prize consists of a stainless steel cocktail shaker and a $100 Visa gift card. So please, the registration information is on the screen in front of you. Please feel free to register here yet before 8 o'clock this evening. Now moving on to the topic at hand, Medicaid expansion. Medicaid expansion is an issue that's been on the radar of us nationally since a Supreme Court decision all the way back in 2012. It's been an issue that's gained and lost momentum at different times over the last number of years here in South Dakota. But right now we are full steam ahead. A large cross-path of a coalition has formed in the state and most recently has submitted signatures to the Secretary of State's office to put a Medicaid expansion initiative on the November 2022 ballot. We are hopeful that any day now the Secretary of State will certify the signatures that have been submitted to put, and the Medicaid expansion ballot initiative will be officially on the November 2022 ballot. So we thought it would be important to bring some individuals that work on this issue that can tell you more about this issue together this evening to educate and inform us about the importance of Medicaid expansion in our state. So I'd like to bring our panel in and start with some introductions. The individuals with us this evening, I've had an opportunity to work with for a number of years. I'm happy to call them colleagues and friends. And we'll go on down the line here and just do a brief introduction and background. Joining us from Pierre is Sandra Waltman with the South Dakota Education Association. Sandra, please give a brief introduction and tell us a little bit about yourself.
Thank you, Eric. My name is Sandra Waltman. I am the Director of Communications and Government Relations for SDEA. I've been with the association for about 15 years. Spent a lot of time at the Capitol with Eric, and I'm looking forward to our conversation this evening.
Thank you, Sandra. Next, I'll go to David Benson with the American Cancer Society Cancer Action Network. David, please tell us a little about yourself.
Thanks, Eric, and thanks to AARP South Dakota for having me. I've been with ACS CAN for 7 years as Government Relations Director, now covering South Dakota and North Dakota. And Eric, I'm a bit disappointed. I didn't get a cocktail kit in the mail, but hey, I've got my apple cider ready to go. So thanks for having me tonight.
Excellent. I've been trying to come up with a joke all day about how I shouldn't have a cocktail and be hosting a live event at the same time. So I can't quite think of one, but those of you that know me will probably agree that it's probably not in the best interest, my best interest, to have a cocktail while hosting this event. So I didn't want to put anyone else in harm's way. Next, we'll go to Jordan Endicott with our AARP office out in DC. Jordan's joining us from the East Coast this evening. Jordan, thanks for staying up a little bit later tonight, and please tell us a little bit about yourself.
Sure, yeah, thanks for having me here. Happy to be on to talk with you all about such an important topic. My name is Jordan Endicott. I am a senior legislative representative on the government affairs team, working on Medicaid and other health access issues.
Wonderful. Thank you, Jordan. And as everyone knows, we have done a lot of virtual events in 2021 and 2020, and a lot of the events go smoothly. A lot of them, have a few hiccups here and there, and sticking true to form. We had a little hiccup tonight with Deb Fisher Clemens from Rivera Health. We couldn't get her streaming on with us, but we are able to reach her via a conference call. So she's joining us via phone this evening, and I think we have a good connection with her. So Deb, thanks for being with us, and please introduce yourself and give us a little bit about your background.
Thanks, Eric. I'm sorry that Avera is such a tough thing technically to get some of these calls created, but hopefully you can hear me. Hi, everyone. I am the Senior Vice President of Policy for Avera. I've been in this role for almost 20 years, so I'm the oldie on this call. And before that, I spent 6 years in the legislature, and I'm a nurse by background, and I have been working on Medicaid expansion since 2012, and hoping that we are going to win this battle this year.
Wonderful, Deb. Well, while it didn't work out all the way, we are very happy to have you with us and provide your expertise on this issue for us this evening. So let's get started with why we're here to talk about Medicaid expansion and hear about your insights and intellect on the issue. Before we get started, though, I just want to mention that for those of you that are tuning in here, there is a chat function that you can utilize to put a question into our panelists. Please feel free to do that at any time. Those questions will make their way to me, and I will do my best to get to it during the time we have allotted for this evening's event. So please utilize the chat function if you have a question that comes up that you'd like to ask our whole panel or anyone specifically on our panel. Please feel free to submit that question. So let's get started. Jordan, thanks again for joining us from the AARP National Office. Wanted to start with a pretty broad, basic, but maybe complicated question. And I know a lot of us know what this is or have heard about this, but kind of wanted to get a kind of a broad overview as far as what is Medicaid expansion. Can you tell us what Medicaid expansion is, what it will do, kind of what the general impact is for those that are affected by it? So Jordan, I'll turn it over to you.
Sure, yeah, I'll try to keep this, plain English and not get too wonky, and try to explain this in a clear manner. So we got to go back in time a little bit to kind of explain the whole picture. The Affordable Care Act, passed over a decade ago, provided for several healthcare reforms. One of those was Medicaid expansion, but as interpreted by the U.S. Supreme Court, it gives states programs the option to cover uninsured adults age 18 to 64 with incomes up to 138% of the federal poverty level, which is about $18,000 per year for a single person. So it's an expansion of existing state Medicaid programs up above what was the previous income limit to cover more people. Unfortunately, without Medicaid expansion, many people are trapped in what is known as the coverage gap, where they make too much to qualify for traditional Medicaid, but not enough to qualify for subsidies to buy insurance on the private market. So, through no fault of their own, these are, hardworking South Dakotans that want coverage, but they make too much for Medicaid, and they make too little to qualify for the subsidies. It's just a quirk of how the Affordable Care Act was interpreted in the Supreme Court when Medicaid expansion became optional for states to pursue. So what that means is that in South Dakota alone, more than 40,000 people are in the coverage gap that would qualify for coverage if Medicaid were to be expanded in the state. The federal government, if Medicaid was expanded, covers 90% of the costs of the coverage. So it's a great financial deal for states. In fact, 38 other states have already expanded Medicaid, including border states Montana, North Dakota, Minnesota, Iowa, and Nebraska. And no state has ever gone back on their decision to expand Medicaid. And expanding Medicaid in South Dakota would bring back millions in tax dollars over the next 5 years. These are tax dollars South Dakotans have already paid that really should be brought back to boost the state's economy. So really all around it makes sense for the health of the state, for the finances of the state. It just makes sense for the state to pursue.
Wonderful. Thanks, Jordan. And you covered that very well. And you talked about the nearly 40,000 plus South Dakotans that would be impacted if Medicaid expansion is implemented here in the state. And obviously, a number of those individuals fall in that 50 to 64 age category. They are working individuals that, as you said, don't have enough income to or don't work at a job that offers them health care coverage. So so they're losing out on just basic every day, every week checkups and standard some healthcare opportunities that I know I probably take for granted. That's very important to them. And then you talked about other states that have implemented Medicaid expansion, and you mentioned the surrounding states. And as we know, similar to South Dakota, they are mostly conservative states that have done so. In recent years, we've seen some other conservative states, most recently that comes to my mind, Oklahoma and Missouri took the Medicaid expansion issue to the voters in their state and were successful in passing that. And obviously that's a blueprint that we hope to replicate here in South Dakota. We know it's going to be a challenge. We know there's going to be opposition. But we also know that, South Dakotans, look out for one another and realize how important healthcare is, in all parts of the states, particularly in rural areas. So thank you for that answer. And we'll be talking more about this here throughout the rest of the evening. Next, I'll go to Sandra with SDA. I'd like to point out that AARP South Dakota is fortunate to have a very strong relationship with our South Dakota Retired School Personnel Group. We also have a number of retired teachers that are key members and key volunteers for us, and I know some of them will be listening in this evening, and we very much appreciate it. Sandra, my question for you is can you please share why an education advocacy group like South Dakota Education Association is active in expanding Medicaid in South Dakota?
Sure. Well, I think the first thing it comes down to is it's about kids. We know that healthier parents will have healthier students, and that will lead to them being able to learn in the classroom. Many of the 42,000 South Dakotans who are not covered by Medicaid and don't have access to health insurance have students. And so for us, it's about helping families get healthier. When mom and dad have access to health care, they're more likely to have their kids see a doctor. So really, the first reason is it really comes down to helping our students have access to better health care. The second reason is Medicaid expansion would help some of the education support personnel that you see in our schools, many of whom are working at $9, $10 an hour. Their families make too much money to qualify for Medicaid, but they have a healthcare need and they can't afford anything on the health exchange. Unfortunately, we have a few instances across the state where you have actual employees of school districts who at the end of certain months, like December, who have to write a check to the district to cover their healthcare costs. So that's another reason we think that expanding Medicaid is important. And the final reason is it's about access for rural healthcare for all educators and families across the state. We have school districts in every size of community, and those communities are finding it more and more difficult to keep providers locally. So we want to make sure that healthcare is available across the state, and we think that expanding Medicaid will help us achieve that goal.
Thank you, Sandra. SDA joining our South Dakotans Decide Healthcare Coalition has been an important involvement, and we really appreciate all that the organization brings to our coalition, and the information you offered as to why is very important. So thank you, Sandra. Next, I'll go to David Benson with American Cancer Society Cancer Action Network. David, what is the impact of Medicaid expansion on cancer patients and cancer survivors?
Well, Eric, the sad truth is that people without comprehensive health coverage like Medicaid are likely to be diagnosed with cancer at a later stage when cancer costs more to treat and are less likely to survive. In 2020, ACS Can released our cost of cancer report and found that cancer patients and survivors experience financial hardship, including problems paying bills, depletion of savings, delaying or skipping needed medical care, and potential bankruptcy. This certainly doesn't come as a surprise to many that are watching tonight. People with lower incomes, rural residents, and those without insurance face greater hardship, especially since uninsured cancer patients are responsible for all of their treatment costs, causing many to forego care. Right here in South Dakota, we hear a number of stories of patients who have been diagnosed with cancer, who have explored the recommended treatment, looked at the costs, and walked out of the clinic after saying, "I will not bankrupt my family." Those patients then died of their untreated cancer. Other patients who had warning signs but waited until they turned 65 and qualified for Medicare before coming in for an evaluation. After such a wait, their cancers were later stage, more difficult, and expensive to treat, and unfortunately offered, again, decreased survival opportunities. Medicaid helps to improve outcomes and reduce the burden of cancer by offering those preventive services like timely cancer screening, early detection services, as well as affordable treatment services and care. And Eric, if I could, one thing I do want to note is cancer knows no border or state line. Unfortunately, health insurance coverage and your ability to access quality, comprehensive health care can be determined by your zip code. And here in South Dakota, we need to pay special attention to the staggering health disparities for American Indians in the state. As a result of expansion, eligible American Indians would have greater access to comprehensive range of health services at locations across the state. This would bring much needed healthcare dollars into IHS, tribal, and urban health facilities that are able to build Medicaid for services at their facilities. So yes, Medicaid expansion would certainly have a life-changing impact on not only cancer patients and survivors, but for all people that are one screening or one doctor visit away from a diagnosis.
Yes, thank you, David. Some very important points there, and I particularly like you pointing out the impact on our Native American population and our tribes in South Dakota. As you know, our coalition has done outreach to tribes to work with them, and to their credit, they know the significance that Medicaid expansion will have on their communities, and have been willing partners to try and push this issue across the finish line here next November. So thank you for for that important information. We've talked about the impact of AARP. We've talked about the impact to cancer survivors, the impact to educators and school personnel. Now we'll kind of go to the other side of it and bring in Deb Fisher-Clemens with Rivera Health, who is obviously with the hospital. And Deb, what is the potential impact of Medicaid expansion on rural hospitals and the rural communities they serve?
Thanks, Eric, for that question and for inviting me to join the group tonight. So Medicaid expansion actually saves rural hospitals. As you have been hearing, as David Benson has indicated, people with cancer don't access care or see a physician, but then don't follow up with treatment. So as more rural, low-income families gain health care coverage through expansion, they also seek care. One of the concerns about what happens today is they don't seek care in a timely fashion for certain diseases. Therefore, they use emergency rooms and then are unable to pay or put their, as David said, put their families into a financial risk situation. So in the states that have passed Medicaid expansion, we have seen less rural hospitals close. And in South Dakota, we have, of the 45 rural hospitals that are currently in operation, 24% have a negative total margin. So in the other states where Medicaid expansion has occurred, those states saw a benefit of increased reimbursement so that they, in fact, could stay open and help provide services to those rural folks. Medicaid expansion helps rural hospitals avoid the uncollectible patient debt and keeps those facilities viable. I recently researched as I prepared for this, and there's a facility in North Dakota where the CEO explains that the expansion brought stability to the financial conditions of his hospital. In states that have expanded, more people access care in a timely and appropriate manner and in the right location. They don't use the emergency room, which is very high cost care. They see their primary care physician. They actually use preventative health services to get diagnosis and treatment of their chronic conditions instead of waiting until they're really sick. And the patients see improved health outcomes. So with more people accessing their cancer screenings, early stage diagnosis rates increase. And then more people also, according to the studies in the states that passed Medicaid expansion, indicate that rural people access treatment for mental health and substance use disorder challenges sooner and more frequently because they have the ability to have their services covered. So Medicaid expansion is also connected with low rates of death. Several studies have demonstrated that in expansion states, they have seen a significant decrease in their mortality rates. And this all has an impact on rural. With South Dakota being so rural, all of these things are very positive in order for us to help keep those rural hospitals open. So the financial stability of a healthcare system on the state itself is that, first of all, the hospital stays, but secondly, it maintains jobs in those communities, and it assures that there is a way to provide other services in that community by keeping that community viable. So with that, we have seen a decrease in annual rural hospital closures in the states that have expanded Medicaid. So we really see the need to do that just to maintain a rural access in our state. Thanks, Eric.
Yeah, no, wonderful information there, Deb, and you know, I think we've seen a couple themes with the answers here tonight. You know, those that are without healthcare coverage that get healthcare coverage, in this case through Medicaid, you know, are more likely to take advantage of preventative services, are more likely to have early detection of potentially serious disease, and then are more likely to have a better health outcome. You know, if they do have the healthcare insurance and are checking those boxes to live a healthy life, and I think that's important to take note of. You know, North Dakota came up a couple times in our answers this evening, our conversation, and has had Medicaid expansion implemented. I think, correct me if I'm wrong here, individuals on the panel, but if I remember correctly, North Dakota, in their legislative session in 2013, so basically 6 months after the Supreme Court decision put Medicaid expansion in the state's hands, North Dakota, their legislature implemented Medicaid expansion and have come back to the table every 2 years since then and kept it in place. And as someone pointed out, you know, every state that has not turned it away at any point because of the impact that it has on their states and their individuals. So we are just just south of them have very similar makeup, but yet we're missing out on this opportunity that they're taking advantage of. And I hope we as a state, we as voters, do take advantage of it when we go to the ballot box in November 2022. Let me offer another reminder to those that are listening in this evening. Please use the chat function if you have any questions that you'd like to submit to our panel. We've been through a round of questions here. Maybe some of the conversation has spurred a question for you. Please feel free to submit it in the chat, whether it's to the group as a whole or any one of the individuals. I grill these guys all the time on all sorts of topics, so feel free to do the same. Let's go back to you, Jordan, and from an AARP perspective, can you please share why increased access of healthcare coverage is important to AARP members, or just more broadly the 50 to 64 population, that age population that Medicaid expansion impacts?
Sure, happy to do that, Eric. We talked about that, over 40,000 South Dakotans would gain coverage through Medicaid expansion. And within that group, there's thousands of people that are age 50 to 64 that would gain coverage through expansion. So that's kind of where our interest comes in, is getting coverage for those 50 to 64 in the state that are in that coverage gap. So these are hardworking South Dakotans that are, parents, grandparents, farmers, small business employees that need access to healthcare coverage, and they currently can't afford it. As Deb mentioned, talking about the rural communities, 50 to 64-year-olds in rural communities throughout the state, especially face challenges with travel distances to access healthcare. So Medicaid expansion helping to keep rural hospitals open really helps the 50 to 64-year-olds in the rural parts of the state continue to be able to access their healthcare. If they lose a hospital in those areas, that can have dire consequences just for anyone being able to access and get the care that they need. As we've seen over the past year and a half, especially, the health needs of the older population can be more complex, and delays in accessing healthcare can have dire consequences, which is why expanding Medicaid now is so important. And it's really, it's late in the game for South Dakota, but it's not too late. And now is the best time to go ahead and do this.
Yeah, thanks, Jordan. I think it was said earlier this evening, but it's important to mention again. South Dakota is only one of 12 states that hasn't implemented Medicaid expansion. And then, I think all of us know, whether we're age 50 plus or not, that as we age, it's important to have reliable, quality healthcare coverage to take care of us as we start to age, and our medical needs change, and of course those that don't have healthcare coverage are impacted more, and Medicaid expansion, it might seem like a small number, if you even break it down from the 42,000 to the individuals that are age 50 to 64 in that population, but it's very important. I think a theme we've heard a lot here over the last year and a half is take care of your friends and neighbors, look out for your friends and neighbors, and this is another opportunity for us to do that, to build a stronger community, to have a strong healthcare system, and to take care of some of the most vulnerable South Dakotans, which I know is important to everyone on this call and those of us listening in. Sandra, let's give you a question here about what kind of talking about between now and November. So I guess about 11 months before we have an opportunity to put this to a vote, but on Medicaid expansion, what is SDA doing to educate their members on Medicaid expansion? And what are going to be some important engagement tactics for SDA leading up to the November 2022 election?
Yeah, thanks for that question, Eric. We are an organization of educators, so we think that education, not just in schools, but on issues like this, is very important. The question we get from educators is, why, I have health insurance, why should I care about Medicaid expansion? And for us, it's going to be a lot of having one-on-one conversations, training our leaders on the importance of why Medicaid is important for our students, our fellow workers, and just our overall communities. So we will be talking about this at building meetings, at union meetings, when we have our unit meetings, our annual meeting, we will be giving a presentation. And then when we are getting closer to the November election, in the work we do to educate our members on the policies we support, we will be sending information in flyers. We'll be, doing one-on-one conversations in the school buildings. Any way and anyhow we can educate our members on this important issue, we are going to use that tactic.
Wonderful. Well, and I think it can't be stressed enough that, and I think to some extent in AARP, I wrestle with this too. Medicaid expansion can be a very complex issue that you're trying to inform your members about. But, I think what it boils down to and what resonates with people is it's building on a program that's already in place. It's offering healthcare coverage to those that don't have it and those that need it. And the vast majority of the instances, these individuals are working. And like we said before, they either can't afford it or their employer doesn't offer it, or both. And that just goes to show you that, that's what it boils down to. And, that argument, I believe, resonates with people because they have so many individual stories of how health insurance has been so important to them. And I know we get our health insurance, my family does, through my wife's position as a teacher in the Sioux Falls School District, and obviously utilize it a bunch during the year. And of course, individuals that we talked about, individuals that once they get it, they will utilize it and be healthier. And that has a significant impact in many different areas. David, we kind of talked about the impact of having health insurance. My question for you is what is ACS CAN seeing for cancer patients and others in states that have expanded Medicaid? What's the positive impact of that? Just kind of we've talked a little bit about what other states, the positive outcomes in other states, the benefits, from a cancer perspective, talk about the benefits for cancer patients, cancer survivors in states that have implemented Medicaid expansion.
Well, before we go too far, I'm just disappointed to hear that Sandra didn't reference all the TikTok videos they're planning on creating during this campaign. So something to look forward to for all of us. To answer your question, it's a great question, and one we certainly like to highlight. Deb has already referenced some of this in her remarks previously, that obviously with Medicaid expansion, you're going to have greater access to those preventive screenings and affordable services and care. That is going to lead to a decrease in the uninsured rate in states that have expanded Medicaid. That leads to decreased hospitals' uncompensated care. In states that have expanded, hospitals are 84% less likely to close. So again, as Deb referenced before, the impact that's going to have for those rural hospitals and across the state, which then again has that ripple effect for cancer patients to be able to have their checkups and additional services right there, hopefully in their home community, or to have emergency care services right there. Stepping back from that expansion population, or those individuals in that 42,500 group, health insurance marketplace premiums are about 7% lower than non-expansion states. So it's going to have a ripple effect for those that are not getting healthcare coverage through Medicaid, but we'll hopefully see their premiums go down with expansion. Another area certainly that we're mindful of with ACS CAN is we've seen a decrease in cigarette and other tobacco product purchases, as well as increased access and coverage of smoking cessation medications. There again, having access to these type of programs that the state already provides funding to, and we could always use some more. But the Medicaid, there's a lot of disparities, a higher rate of use of those tobacco products that, again, we're providing those services to help individuals curb themselves away from those products. And as referenced before, obviously Medicaid provides individuals and families that financial protection. We all know that this treatment is oftentimes incredibly expensive yet necessary, and so Medicaid provides individuals and families with that financial protection. So again, all this leads to helping reduce health disparities and improve health outcomes, including life expectancy.
Excellent. Thank you for that information and that background. And we talked a lot about the positive and the benefits, and it can't be stated enough that cancer patients are so impacted by it, and the potential to prevent a cancer from being treatable to untreatable just by having healthcare and coverage is so significant, and we all know that. Deb, I'm going to go to you again. Maybe, I think you mentioned it in your introduction. You've been with Rivera for a long time. Prior to that, you were a nurse, and you've also been a state legislator. So quite the pedigree. And I'm going to maybe ask you to put your nurse hat on now a little bit, and going to other states that have passed Medicaid expansion. What are the benefits for the patients, the hospitals, and specifically, their staff? We've heard a lot about the burden that hospital staff has been on in the last year and a half during the COVID pandemic. We appreciate everything that they have done for our communities and our community members. But can you kind of talk about the impact of Medicaid expansion, on hospitals and their staff, and how that's translated from states that have it and states that don't have Medicaid expansion?
Thanks, Eric. I'm going to talk a little bit about the states that have expanded and just give some comparisons. And so I'm going to start with Montana because the study that was done demonstrated in 2020 during the pandemic that the economic distress of folks resulted in an increase of about 13,000 enrollees to Medicaid because of the fact that people had lost jobs and were dealing with the whole COVID situation. So we see the economic distress, and yet we still need to make sure that people get access. And I think that the impact of COVID in South Dakota has been huge, as you mentioned. And when people are in economic distress, don't have jobs, they are not seeking care. And we are seeing the outcome of that in that the hospitals in this state, and I can speak to across the system of Rivera in our entire footprint, the beds are full. We are using our transfer center to try and control that, and we are seeing 10 to 15 patients per day that are on a waiting list to get a bed, and that's not just at McKinnon. That is across our 38-bed footprint. So it is a huge issue, and it's not just COVID, it's people that are now seeking care for chronic conditions because they were unable to pay earlier, and because of the COVID that they were unsure if they wanted to even come to a hospital. So there's lots of issues related to that. In addition, states that have expanded Medicaid have significantly lower uninsured rates. So in Minnesota, that it has expanded in 2014, they've seen a decrease in uninsured people from 10% to 5% in a short 3-year period. In the same period in Illinois, they saw that they decreased the uninsured rate from 14% to 8%. And expansion enrollees have increased access to their services and report better health outcomes. Again, in Montana, 30,000 expansion enrollees received mental health treatment, and over 40% of expansion enrollees actually reported that their health improved. In Minnesota, where expansion covers over 200,000 individuals, hospital admissions have reduced by 14% because people have sought care at an appropriate time because they had the resources. And emergency room visits in Minnesota were reduced by 7% as more people gained coverage and received routine care. One of the issues that I really want to talk about that I think is important to South Dakota is that the state, a Kaiser Family Foundation study demonstrated over and over that there were improvements in outcomes related to the fact that women were able to access postpartum care because they had coverage, and the use of care among pregnant women and mothers improved tremendously in most of the states, as the study demonstrated. Another benefit is the economic impact on state budgets, hospitals, and providers. So again, in Montana, Medicaid expansion was found to have supported 6,000 jobs that contributed $350 million in personal income growth in the state. Studies have also found that expansion caused a significant reduction in poverty. Thus, low-income families were not burdened with their high-cost medical bills and were able to put food on the table and live healthier lives. And Iowa Hospital Association determined that employment in Iowa hospitals had a significant impact on the state following Medicaid expansion, which included an increase in retail sales and an improvement to the state of $288 million in sales tax. Now, South Dakota, as you've heard, is projected to cover over 40,000 people. It's projected to gain 4,200 jobs, including 2,200 in healthcare, 400 in construction, 500 in retail, 200 in finance and insurance, and an additional 900 in other sectors. Additionally, South Dakota would increase state output by an estimated $800 million if Medicaid were expanded in 2022, as well as an increase in state gross product of $500 million and personal income of $300 million. Per the South Dakota Legislative Research Council, South Dakota, the state would benefit by more than a 15-to-1 return on investment from the dollars that they would invest and based on the dollars that they would receive federally to assist these folks. So with that, I would say that Medicaid expansion is absolutely the right thing to do. The state benefits, employers benefit, workers benefit, and most of all, those individuals who have health issues benefit. And that's what we're about, is making sure that people are able to access care in the appropriate place at the appropriate time. Thanks, Eric.
Yeah, no, thanks, Deb. A very comprehensive answer there that touched on a lot of important benefits of Medicaid expansion. A couple of things I just like to touch on. You talked about how those that are uninsured now, unfortunately, one of their primary forms of care is to visit an emergency room, which puts a lot of pressure on our hospitals, on our emergency room personnel, and frankly, just isn't how we should get healthcare coverage, right? If you think about it, I shouldn't, have to wait until the very end to go and then ultimately decide to go to the emergency room to get something looked at if I'm having a health issue. So I think, addressing that is important, and there's a cost associated with that we could get into. And then another important issue that you brought up, and an issue that we hear about a lot in the state, is workforce, right? I think all of us on this panel here, have had this conversation where implementing Medicaid expansion is a workforce issue, addresses the workforce issue. We've heard a lot about workforce shortage, in South Dakota in recent years. And I think it's in our opinion that Medicaid expansion helps address the workforce issue by giving these individuals health care coverage. So therefore it keeps our individuals working longer, staying healthy, and being in the workforce for extended periods of time. So, that's a benefit that I think would play well with South Dakotans that know the challenges that we have in the workforce area right now. So thank you for that information. I kind of want to transition here to just a couple questions. One last offer for anyone listening in tonight to offer a question via your chat function to ask a question of our panelists. We'll kind of open this up as a group answer, but I'm going to start with David Benson and ask others to follow up if they have any thoughts. We've talked a lot about the benefits of Medicaid expansion, why it's important, what it will do, but we also aren't naive enough to know that we have opposition out there. We've seen it in other states, particularly in rural red states that oppose Medicaid expansion. What are some, David, not to put you on the spot, but I'm putting you on the spot because I like doing that, but what are some of the arguments that opponents will use? And as a coalition that supports Medicaid expansion, how do we counter them? Do you have any thoughts on that, my friend?
Well, they're going to throw a lot at us, and I think it's going to be a lot of just ways to distract voters, trying to get them to not really look at the reality of what's happening in these 38 other states. And the reality is that it's saving lives. It's investing in the state to invest other places and to create savings. And due to the recent and ongoing federal incentives that are provided to non-expansion states, this is a no-brainer. And we've talked a lot tonight about the economic impact and the access to healthcare coverage. But certainly they're going to look at long-term costs. But the reality here is that South Dakota has an opportunity to make the most of these incentives, to create additional savings, to invest into the long-term stability and sustainability of Medicaid expansion to cover these individuals and future individuals that are needing access to healthcare coverage. So the thing that's working in our favor, unfortunately, is because we waited so long to get to this point, that we can look at the states. Most of our border states have expanded and see what they have done, see what has worked, and do what's right for South Dakota. And what this coalition, South Dakotans Decide Healthcare, has done is it's bringing together a diverse, broad, nonpartisan group of partners that understand the various dynamics of the state and are coming together to bring this to the voters and putting politics aside. And we're very fortunate that we have this process of a ballot measure question that we can circulate petitions and give ourselves this opportunity. But certainly we need to do our due diligence as partner organizations and really appreciate AARP being part of this coalition and with their members. Because I think when we talk to our neighbors, we talk to our coworkers and friends and talk about the various things that we talked about tonight, it's a win-win-win-win. And we feel very, very positive about how this will turn out in November 2022. But we got to put in the work.
Wonderful. Thank you, David. Sandra, I'm going to pose that question to you and tweak it just a little bit, SDEA related. I think, one of the arguments by the opponents that I heard early in the conversation was there's no way SDA will support Medicaid expansion because the small amount of money that it will take from the state budget every year will be money that's taken away from teachers. Yet here you are in our coalition, understand the importance of it for your membership. So, can you kind of, debunk that argument that I'm sure we'll probably hear again in the coming months and offer any other thoughts about, some of the arguments that we might hear against it and how we can counter them?
Well, thanks again for that question, Eric. That is something that has been posed. It's going to be education is going to lose out if we expand Medicaid. And I would argue that we will lose out if we don't expand Medicaid. Part of educating children is making sure that we have healthy children, healthy families, and healthy communities. And I think Deb laid out all of the positive economic impacts this will have on our state and what that will mean for funding education. We are seeing another thing that I think is important is we are seeing an increased number of teachers who are saying we are starting to have more and more mental health issues with our students. And this goes back to the point of Medicaid expansion is going to help, especially those students in rural communities, have access to healthcare through the expansion of Medicaid, whether that be allowing their families to finally have access to healthcare or making sure facilities and providers are still in those communities. And the final thing I would bring up is it's not a secret. South Dakota has a teacher and educator shortage. If small rural communities want to be able to continue to bring people in to their schools to teach, one of the things that potential applicants will look at is, do I have access to healthcare? So again, while we think it's very important for those 40,000 plus South Dakotans to have access to Medicaid and healthcare, it really is about providing healthier communities, which is how schools will be more successful. So it's not an either or. It's really about having healthy communities, and that will make our schools stronger. And I would argue that it will cost us more in the long run if we continue to deny families access to healthcare.
No, thank you, Sandra. All very good points. Jordan, you've been involved. I know you haven't been with us terribly long, but you've kind of seen some other Medicaid expansion campaigns in other states. Is there any insight you can share as far as who are some of the opponents and what are the arguments they use and how can they be countered? Is there anything you can offer us on that?
Sure, yeah, happy to. I'm actually based in Oklahoma, so I've been through the whole Medicaid expansion campaign here from start to finish. So I've kind of, seen it all on the ground from that kind of firsthand perspective. Going back to the threats on education, that was a threat that was made, here by, the governor, by leadership in the legislature. If Medicaid expansion passes, we're going to have to cut education to balance the budget. None of that was true. They actually have budget savings from Medicaid expansion. They haven't spent any of the money appropriated for Medicaid expansion in the state yet because there's been so much cost savings. So, education is, not been cut at all in Oklahoma. I haven't seen that play out in other states. I'm sure that threat will come up in South Dakota, and it sounds scary. And obviously don't want cuts to education, but it's not something that comes to pass. Where the opposition tends to come from, it can come from kind of more of think tank organizations, other groups like that tend to do that kind of spending. They don't have a lot of evidence to stand on. As we've said today, as you heard from all the panelists today, there's so much evidence backing Medicaid expansion that usually all opposition has is stirring up kind of fear, the unknown, what'll happen if we do this, that sort of thing. But 38 other states have done this. They've all been successful. They've all reaped benefits. They've all had populations get healthier, live longer lives, be able to access healthcare, improve their economies. So I think that the point was made earlier. The bad thing is, South Dakota is kind of late in the game here, but the good thing with that is that we have all this evidence now showing that, this works, it's effective, we can do this, we can help the state and move things forward.
Wonderful. Thank you, Jordan. Deb, I'm going to bring you in and kind of pose a different question for you. David, Sandra, and I, along with you, spend a lot of time in Pierre each year during the legislative session. You have a tremendous amount of experience out there. Of course, yesterday, Governor Noem gave her annual budget address. With stimulus packages and other revenue, there's a number of dollars available for different programs. Unfortunately, we didn't hear any money dedicated towards implementing Medicaid expansion. And frankly, we weren't expecting to. But my question to you is to put your legislative lobbyist hat on and kind of look into a crystal ball and see how or if you think our legislature will address Medicaid expansion during the 2022 legislative session.
Well, thanks, Eric. That's a good question. I'm going to answer it in a couple of different ways. So first of all, as you heard the governor say, that lots of people are flocking to South Dakota, and they are truly coming here, and because they love the freedom. But the interesting thing that we in healthcare have found is that when people go to see a physician, and they get their bill, they say, "Well, I'm on Medicaid," And no, you're not. And they're very surprised by the fact that we don't have Medicaid expansion and that they don't qualify. So we've seen that happen time and again with individuals seeking care. And I haven't certainly tracked to see if they come back to get more care, but we know that people are concerned and surprised when they learn that they've moved here and there's not Medicaid expansion. I think the argument that I have heard, and I think we will hear it from legislators over and over if there is any Medicaid expansion discussion, is that the federal government is going to renege on this. They're going to take the money away. The state's going to lose money, and it will be a bad deal. And that those other 38 states are going to have the money taken away as well because the federal government just can't do this. And my answer to that is there are both red and blue states that have expanded Medicaid, a lot of red states, and those Congress members understand and value what Medicaid expansion has done for their states. So my argument for any legislators that want to suggest to me that the federal government is going to take that away, the federal government would have to have the votes from a whole lot of both blue and red state Congress people, and that is, I don't believe, could happen. So when I hear that, I get very, I feel like I have an answer that because that is just plain not going to happen. I do think that we will have discussions about Medicaid expansion because I believe that there will be at least one attempt to do a bill so that that people wouldn't have to vote on this. I think that discussion will be very interesting. I think we'll hear lots of reasons why South Dakota should not do it, and you've heard many of them already because of what happened in other states. I think we have to stand really strong on the fact that, number one, our enrollees currently in Medicaid, 2 out of 7 are children, only 1 out of 14 are adults, and we have nursing home residents that 1 in every 2 nursing home residents is currently on Medicaid, and I envision that there would be more. 1 in 4 individuals with disabilities have Medicaid, and 1 in 8 Medicare beneficiaries. So in addition, I would argue that adults and children enrollees are at 76% of our population, and elderly and disabled are 24% of our Medicaid enrollees currently. So if we're concerned about kids, elderly, and disabled in this state, we need to expand Medicaid because we know we're not covering everybody. 14% of our South Dakota population is currently covered by Medicaid and CHIP, but we also know that 27% of our population is low income, less than 200% of the federal poverty level. And so I think we have a lot of arguments to share in regards to why we need Medicaid expansion, and in the same token, we have arguments to say it's not going away. We're not going to see the money be taken away. And if we really do care about our people and you, Mr. and Ms. Legislator, your constituents, you need to work to improve our Medicaid numbers. And the only way we can do that is by doing an expansion, like the other 38 states that did.
Well said, Deb. And I think just to summarize it up a little bit, that you're right. I expect that there will be a bill introduced during the 2022 legislative session that would implement Medicaid expansion in South Dakota. And then everything after that, I can't predict at all. But we know it's going to be an issue that's going to be at the top of the mind for our state, our voters, and those impacted by the issue, starting now and going forward to November 2022. And there will be a lot more information out there. I know the organizations involved in this call will be working with their members and their advocates to keep pushing forward on the issue. And we've had a wonderful conversation about it this evening. And I kind of want to wrap up here now. We've already reached an hour, and thank our panelists for joining us this evening. Sandra, David, Deb, Jordan, really appreciate you taking the time to join us. For all of our members and partners out there, we know it's a busy time of year. Thanks for logging on and learning about this important issue with us. And finally, I want to thank the AARP staff that helped put this event together. Really appreciate your help. And for our members that are on the call that haven't registered for the event, remember, it's not too late. You can still register, and by registering, we'll send you this wonderful cocktail kit, and you'll also be registered for our grand prize drawing. So with that, I would like to wish everyone a happy holidays, have a wonderful Christmas, a happy New Year, and wish you nothing but the best in 2022. And thanks again for joining us this evening. Good night.